Hey, I'm Dr. Raghu Appasani. I'm an integrative psychiatrist and psychotherapist based here in San Francisco, California. My approach to psychiatry is one that is holistic and integrative. And what I mean by that is using medications only when indicated, always having a plan of when someone might be able to come off, but more importantly, looking at their psychosocial factors, things like their social relationships, access to resources in the community, daily activities and routine, and more importantly, as well, nutrition and what they're putting into their body. And so I developed a private practice called Appasani MD, and it is functional. And I see patients in California as well as New York, and it's very, very personalized, where we look at everything from not only their family and home structure, but also their interactions at work and or school, and most importantly, their metabolic health and the state of their actual body. And based off all that information, we're able to figure out a treatment plan that can be effective for them. I got started and I was not very happy with the current health record systems out there. And I came across Osmind and was just really blown away by the ease as to how to use it, the accessibility for my patients to have an app actually, and to journal in and fill out surveys and really monitor how they're doing, and the ease that they have access to me through the messaging system. And so it's really streamlined my clinical practice in a way that I'm able to spend more time with my patients. And that's really what it comes down to. And that's how you make change, is spending time with your patients. When I was looking at choosing an EHR system for my private clinical practice, the most important things for me were: one, ease of use, where I wasn't going to be stuck doing documentation. The second was the patient interface. So I wanted patients to be able to have access to me through a secure messaging system, but also access in a way to monitor how they're doing. And that's why Osmind really stood out to me, because they have a very clean UX patient interface app on their phone that allows them to see appointments, it allows them to journal, it allows them to keep up with their mood and fill out forms and surveys, and also communicate with me. The other benefit I quickly learned is that billing became very easy, documentation became very easy, and communication with the team was very, very quick if I ever needed anything. It's just so easy to do your documentation quickly, review charts, and also do billing very quickly. And it just makes it less burdensome, and it takes away that level of burnout where every time I see a patient, I'm very happy to see them and I'm super excited to see them. And that's what it comes down to. Is the best thing about Osmind is that it allows you to spend more time with your patients. One of the other benefits of using Osmind is the Osmind community. And that's been very helpful for me as an early career psychiatrist who just started their own private practice, because it can feel pretty alone and lonely when you're operating on your own and trying to do these things. But the community that Osmind has created has been very effective in answering questions for me, from anything from billing codes to documentation to medications and cases, to getting in touch with therapists that I would need for my patients. And so I find the community to be really wonderful in that way. The second benefit of the Osmind community is ongoing webinars, where they bring in special guests to talk about new topics in the future of psychiatry. And that's super exciting to keep up my own education, and also have a dialogue and a conversation with all of the attendees and participants, part of the Osmind community. The future of psychiatry is an interdisciplinary one that incorporates professions ranging from mental health to nutrition to fitness and exercise. I know that the intention behind the company and the vision is very aligned with my approach to psychiatry and my vision of the future of psychiatry. And the thing that I like most about the Osmind team is that they're constantly open to feedback and they're constantly updating the platform. And that's really what it takes. A lot of other EHRs, it's very hard to get in communication with leadership. It's hard to make changes that you need. And so with Osmind, I find that because it's a newer company, perhaps, but also an innovative company that understands the future of psychiatry, I know that I'm going to be with them for a very, very long time because they're constantly transforming. And so the fact that they have practicing psychiatrists on their leadership team is a sign that they care and recognize the importance of actually involving clinicians in the business model. Not only do I have a clinical practice, but accessibility in mental health care is very important to me. The Minds Foundation is a nonprofit organization that I founded in 2010 in rural India, and we've expanded since then. It's very important to me. This is almost 13 years now operating this organization, and we've hit over 5.5 million individuals directly through increasing mental health education, the first and only 24-hour toll-free mental helpline for India, and very subsidized counseling. And it's very important to me, not only because of that impact and because I founded it, but more importantly, because I've learned so much working in other communities about mental health, and that regardless of where you are, we can all face mental health issues and we can all help one another. And it's through giving someone a platform to share their story that they can heal.